Thank you very much. The first thing I want to say is, wow, what am I doing here? I've been going to workshops and conferences for close to 40 years, I must confess, and certainly as you get on more and more, you arrive at a conference in the morning and you have lots of time for schmoozing and talking and with everybody you know. And I walked in this morning and I didn't know anybody. It didn't take very long to get to know a few people. But this, I think, is for me, I'm already having a real wow experience as a pediatrician. And I think that this is so critical also for the topic we're going to talk about. What am I doing out?
I have to say that when we were thinking about this session, it was so obvious to us that you so belong to us.
Thank you.
And we said, yes,
Well.
yes, we are talking about community, we are talking about everybody. It's not only the Office of Education. Yes, we know Professor Boaz Porter. Yes, there are initiatives that bring books into the community. So you're absolutely...
Thank you. Flattery will get you everywhere, as they say. Thank you. So what do I want to... I want to very briefly present somebody else's idea and how an idea really blossomed into something so overwhelming, almost as overwhelming as managing a $2 billion budget, something I can't even envision. But so what I'm going to talk about is an out-of-the-box, simple idea. I had the great privilege, after coming back from my training in pediatrics as a pediatric endocrinologist, I landed up at the Faculty of Health Sciences at Ben-Gurion University, and I quickly realized that I really wasn't interested in pediatric endocrinology, and they were very keen on somebody working in the community, and I went and spent 7 years setting up a teaching pediatric clinic in a development town, a small town called Ofakim outside of Beersheba, and I had 7 years of self-learning, because no pediatrician that I knew in the country had any idea, and they all thought that I was totally crazy because you didn't do that sort of thing. And 7 years I found myself exposed to a world of issues that I'd never dreamed about: family problems, school problems, community problems, and I didn't know how to phrase the problem, never mind to look for the solution. But then I had a great opportunity when I was actually quite burnt out. But after those 7 years, I said, you know what I'm missing? I know nothing about children. I know everything, a lot about diseases, but I don't know anything really about children. And I decided to go on a sabbatical, which turned out to be a sort of abbreviated fellowship in what's called in the United States today behavioral developmental pediatrics. And suddenly I said, wow, this is where I want to be. And I met a young pediatrician. I was the first fellow to work with him. His name is Barry Zuckerman at Boston City Hospital. And we became very good friends. And over the year that I had this wonderful experience starting to understand this new morbidity, these new issues facing children, Barry and I used to sit and over coffee endlessly, and he would mumble all the time, you know, I'm looking for a small idea that'll make a big impact. And I said, yeah, you know, we're all looking for that. And I finished my fellowship, and I came back to Israel. And I carried on my work, moving more into the area of behavioral developmental pediatrics. And then, a few years later, Barry wrote me a mail, and he said, I've got it. And I said, what? And he said, I've got the idea that I was looking for. He said, I'm going to start getting children to read through well baby care. I said, yeah, sounds interesting. I didn't really know what he was talking about. But then I came back and visited him, and I saw this unbelievable program that he developed. And what I'm going to run through that program now, trying to emphasize how the policy issues are so critical for the success of this program. First of all, he had to have the program work in the clinic. I'll talk about it in a little way. Then he had to get the pediatricians on board, and he did. And then he got the American Academy of Pediatrics to come out with a statement saying that early reading should be part of world child care like immunizations. Wow. Then the other issues that I want to talk about that I think is, and this, when I sit in this forum, it really is so obvious, is the need to break down the silos. I'm a pediatrician, we work in the area of health, and then there are educationists, and then there are people who work in revacha, in social welfare, and never do, well, not far too little, certainly the pediatricians, ever get together. And gee, there, I'm so interested in reading and children, and here I have to come to Van Leer today, and at this ripe old age to suddenly start hearing, wow, there's all this stuff going on with reading and early education. The need for an evidence base is absolutely critical, and I'll talk about that a little more. The need for money is so critical, and that was such an amazing part of Barry's success. The need to get the politicians on board, and really the most important thing of all, which Barry's program called Reach Out and Read did, was to make it a sustainable program. It wasn't a shot in the dark. We are so good in this country, and certainly I'll just speak about in medicine, in pediatrics. You do a project and you start something and it runs for a year and then it disappears, and you write the paper about it and maybe this will advance your academic status, but nothing really remains of it. So after that introduction, let me talk. In 1980s, the parents of the children at Boston City Hospital sort of challenged Children's Hospital in Boston, which was the height of tertiary fancy care, subspecialist care in every field you wanted. Harvard, terrifying place to be in. I used to visit there. Boston City was in the middle of the worst area in Boston. It was kind of scary to go out and have a cup of coffee, but there was a wonderful kind of atmosphere. The chairman of the department was a wonderful man, the late Joel Alpert, who was also one of my mentors, and he gave me the opportunity to be there with Barry. And what happened, Boston City Hospital concentrated very much on community and what's called primary care as an important basis of pediatrics. And then the story goes, as I heard it from Barry, that, a couple of these smart residents came home and they said, we noticed the parents don't read to their kids. We sort of casually talked about it, and they say they don't have any books. So Barry said, okay, we'll put books in the clinic. And they put books in the clinic for a while. And then the residents came back to him and they said, Barry, it's not working. And he said, why? He said, they're stealing the books. And then, this is where a smart guy makes a smart decision. He said, maybe they're stealing the books because they've got no other way to get books. So let's try and give them a book some other way. And there, the idea started, and of a 3-point program to train pediatricians to give developmentally appropriate advice about reading, to give books at each visit from 6 months to 5 years, and to have volunteers modeling reading to the children in the waiting room. And they later changed this to what they called a literary rich waiting room. A grant proposal was submitted shortly after they started it and was turned down because it wasn't related to the silo of health. But they didn't stop. So there was the model: advise parents of infants, toddlers and preschoolers about the importance of reading. To this day, I say to a pediatrician, 6 months. Tell the parents they must give the kid a book. What? 6 months? What are you talking about, 6 months? Well, the kid can take a book and put it in his mouth. And this was a very important piece of the developmentally appropriate ways of teaching reading. And Barry did a brilliant thing, that he created a little booklet about child development milestones, which every resident had in his pocket: when the child should crawl, when the child should stand, when he should walk, when he should say the first few words, when he should start talking more. But he also put, which you didn't find in any textbook, developmental milestones for reading. In the beginning, the child puts the book in the mouth, then it starts staring in the face, then it starts flipping pages, etc., etc. Okay. Counseling about book-related strategies, modeling, and giving, the real whammo of this program was, in the middle of the ghetto, you finish your well-being visit, you talk about the importance of reading, and then you say, here's the present, here's a book. And they walk, and the child walks out with a big smile, clutching a book under its head, or the parent for that matter. So this was a giant step, a paradigm shift, whatever we want to call it, for pediatricians to start thinking, can we do something with reading? Sorry, I have a problem with my mouth. So, in fact, the program started in 1989, when they distributed 1,000 books, developed by Barry Zuckerman and Robert Needleman. And in 1991, again, they still had the one program, about 1,000 books being distributed each year. And then the first research was done by Dr. Needleman, which showed that parents who get books are more likely to report reading aloud at home. And of course, this was at the same time that there was touchstone with the education people, and data like this started coming out about the 30 million word gap, which put the social side aspect of this whole thing of reading, the development of words, that you found this clear gradient between socioeconomic class and the number of words that a child was developing. 1996, we keep moving along. Reach Out and Read. The program works with the American Academy of Pediatrics in a program called CATCH, Community Access to Child Health, to foster expanding the program, and doubles the number of programs in 1 year. In 1998, the American Academy of Pediatrics officially endorses the program. This is, the conservative father, mother, pro-institute which controls everything going on in pediatrics, and they are convinced, and to make the American Academy of Pediatrics takes up some new issue is major politics, and they did it. Reach Out and Read medical director Dr. Perry Klass gets to the US Senate and talks about the importance of literary promotion by providers of pediatric care. And then the next bit of real smart policy making, Reach Out and Read makes an agreement with Scholastic, the biggest publisher of children's books in the United States, which comes on board on supplying the books at reduced price and helping the Reach Out and Read programs. It didn't stop there. Ralph Lauren was persuaded to somehow link up their sales to and offer discounts and supply presents of books for sales of their products. A credit card, of course, with Reach Out and Read. All these things became terribly important. And, the marketing of Reach Out and Read was amazing. Their posters are amazing. And, treatment for success. This linking of health with the reading for success was just amazing. In 2000, Reach Out and Read gets $2 million from the Department of Education. It receives its first state funding, $500,000. And then another study comes out showing that children in the program score higher than their peers on language assessment, both in speaking and understanding. The messages keep going out. Read to your child 20 minutes every day. Health and literacy. We start marketing that idea. Health literacy, I'm sure a lot of you know, the degree to which individuals can obtain, process, and understand basic health information. In 2003, a national assessment of literacy, 36%, 90 million adults had basic or below basic literacy. That is, they lacked the skills to effectively negotiate the health system. And there's a nice little bit of, what's his name again? As you all know, reading the inserts on a drug by Bart Simpson, to try and understand an insert for drugs, which is something I as a doctor even hadn't thought about much. Poor people, they aren't able to do that if they haven't learned to read properly. Okay, then the big jump forward, 2001, already 1,400 programs in the States. Reach Out and Read receives its first $1 million grant. Laura Bush names Reach Out and Read a key component of her Ready to Read, Ready to Learn initiative, which I'm sure. And Pediatrics publishes Dr. Alan Mendelssohn's study, which finds that children, when they Reach Out and Read, score significantly higher than their peers on vocabulary tests. In 2005, a jump to 2,800 programs, 2.3 million children being served, a $10 million federal appropriation for Reach Out and Read, 500 programs, an additional 400,000 children. And in 2006, 3,300 programs, nearly 5 million books. Reach Out and Read is the only American literacy program featured at the White House Conference on Global Literature and distributes its 20 millionth book. Okay, 2010, 6 million books, and Reach Out and Read now serving more than 1/3 of American children living in poverty. Partnerships with public libraries becomes also part of the game. So talking the horse's mouth, of course, is my friend Barry Zuckerman. When I emailed him about this conference, he was terribly excited and terribly flattered that, that it was happening and I was going to talk about it. And I said, well, tell me, how do you sum things up? He said, well, research evidence has been terribly important. It's not hard enough research. It's still a lot of soft research about how much they're reading. They're reading more hours. They like books more, all this sort of thing. We don't yet have studies really showing that those kids are charging ahead more in school, but I guess they're still working on it. It's still taking a long time. Politics, I think this was amazing. The bipartisan support. He wrote to me that the Conservatives believed that the parents, not child care, and the government shouldn't be supporting it, and so they liked that idea, and they were happy to give money because it was for the parents and not for government, and the Liberals were happy, of course, to giving the books. Kennedy and both, what's his name? The late Ted Kennedy and Hillary Clinton championed the program after Laura Bush. The doctor's time was donated, no additional cost. This was inserted into the well baby care. And this was very important. And as I said, the American Academy of Pediatrics, these were the critical features for this wonderful program. 2 minutes on Israel, okay? I'm all right for time. For Israel. In 2000, I was in a senior management position in Maccabi, and I said, you know what, it's time to give this a shot. Barry was actually pushing me. He said, we haven't made much of an impact outside of America. Why don't you try it there? I presented it to the people in the fund, and they said, well, you know, it's a problem. We have this national health insurance law, and you can only do things or give things which are within the law. So if you want to give out, even if we want to give you money for books, we're not allowed to by the law. So they had a very easy cop-out there that unless the annual meeting which determined the sal hatrufot, the basket of medications to be included in the National Health Insurance Law each year, unless they would put books in that basket, you couldn't pay for it. But then we did manage to link up with one of the big book publishers, Kineret Zmora, and they were enthusiastic. And he said, first of all, he gave an initial present of a few thousand books to get the thing going, and he said he'll supply the books afterwards at almost cost. And of course it was a good advertisement when we did fairs and things, so we had a good link up there. And then we managed to get Maccabi to agree through one of its subsidiary funds, which is called Keren Maccabi, which is a fund where every member of the health fund, they don't really know it, most members, pay 1 shekel a month, a quarter a month. And this fund can be used for social programs. We got it. Managed to convince the head of Keren Maccabi. He bought the idea immediately, and they have been supporting it since then. We've been holding book fairs with local authorities, publishers, and we've actually, 2 or 3 years ago, for the first time, we got reach out and read, which we call Kria, Le Kria, which is a nice play on words in Hebrew. We got this included as part of the standard health promotion activities of well baby care in the Maccabi Health Fund. We have our motto, books are part of our children's health. Another one we have, which we advertise, inoculate your children against illiteracy with books. So where are we today? Our program operates today in 75 pediatric clinics of Maccabi, in all of the well baby clinics of Maccabi, which is about 110 nurses. We don't give as many books as the program usually in America prescribes. We give books at 9 months and 2.5 years. But we try to get the explanation and the encouragement given at every visit. We distribute about 20,000 books a year, 13,000 Hebrew books, 2,000 Arabic books, and 5,000 to the ultra-Orthodox sector. This was a sort of interesting part which I was sort of ambivalent about, but we discovered that the ultra-Orthodox communities, they looked at the books. In the beginning they said, well, you know, we can't have books with pictures of, if there's a pig in the book or a rabbit in the book, or there was a long list of, you can't have women with exposed, so we said, well, shall we, so we said either we leave them out or else we go in and do special books targeted to this community. And I decided, and I supported this idea afterwards, because I said that the standard way of teaching children in these ultra-Orthodox settings very often is a rote system of learning letters, learning words, coming to first grade, being able to spit out words, but never having really sat down and read anything except prayer books. So if we could get in through books with conservatively dressed people with no piggies in the book, well, that was fine with me. So, how are we today with our program of Kria Le Kria? There's still high enthusiasm and support from the management, right up to the CEO. This was a wonderful thing about reach out and read, and Barry talked about it all the time. it's such an easy sell. Everybody understood it. And the CEO in Maccabi, when he as soon as he heard about it, he said, get all of the regional medical directors together. I'll pay for the half day, and you do a session. In other words, right away he was on board. They also, the clinic directors, not the physicians, saw it as a nice way for them to increase their profile, show how well they're doing in serving their population. The nurses enjoyed the expanded role as child educators. The problems with the program, I regret to say, but I'll say it in this small forum here, is that the people that we really wanted to be the main ones pushing the program, the doctors, it's difficult to get them on board. The doctors are working under pressured situations. A lot of them work as independent physicians. They have 10 minutes, some usually, for a visit. And it's kind of hard to get them to come on board. I say, look, it's 2 minutes. It's 2 minutes. Just talk to them about the books. Take the book, read it for 1 page with a child and give them the present. You'll see, they'll love you forevermore. Well, slowly they're coming along, but we've still got a long way to go. So, the other thing is we haven't really managed yet to spread the word to the other HMOs. I'll tell you why. Because that's the way this country works. Everybody wants to be the first and the best. Nobody wants to be following. It's all a competitive thing that, so it's hard to break this down. So I'm trying to work through the profession.
Knows about it, but they do not.
It's not there yet, right. They know about it, but we haven't managed yet to build alliances with education and social welfare service. I mean, it's ridiculous that program is there as a silo and that people aren't seeing what the education and all you people are doing with books. And, of course, we should have more politicians getting on board with us. And I think that this would be one way to start, maybe getting politicians to understand that children really need to be a priority. Well, I hope we can do it sometime. Thank you very much.